Good afternoon and welcome to our AALHE Exemplar session, Two Changemakers in Assessment Culture. My name is Dr. Sherry Poppin. Thank you so much for joining us today. I have just a couple of housekeeping items while folks are joining this session. We are recording this session. It will be made available to the AALHE conference registered attendees in the conference app Whova, which is available until July 2nd. It's also being recorded for those of you who are Weave members who are attending at our invitation, and you'll receive an email tomorrow afternoon with the session recording. Throughout the session, if you have questions for the presenters, please feel free to post those in the Q&A and use the chat to say hello and introduce yourselves. But I'd like to get right to our session. We have a lot of really good information to share with you today. So one of the really great things I get to do here at Weave is teach our Introduction to Effective Assessment Practices course for the Weave Academy. And during that course, I meet a lot of campus leaders who are doing the hard work of in the trenches assessment work on their campuses. And part of that course is tackling an assessment project on campus that either needs revising or that needs to just be built from scratch. And when that happens, we get to witness firsthand how assessment culture is being reshaped and refocused on the improvement of student learning. So when I heard about the theme for this year's AALHE conference, I knew I had to have two of our Weave Academy alumni tell their stories. So first today, we're going to hear from Sandra Wald and Casey Leach from Central Methodist University. Sandra is the Assistant Dean at CMU, and Casey Leach is the Program Chair for the Applied Behavioral Analysis online program. So normally I take a lot longer to tout all of their many accomplishments, but I really want to turn this over to them so that we can hear their story. And so without further ado, Sandra is going to take it away and tell us a little bit about Central Methodist University.
Sure. My name is Sandra Wald. I'm an assistant dean at Central Methodist. I've been here a while, but I'm fairly new to the assessment world. CMU is a small private college. We're historically affiliated with the Methodist Church. Our residential campus is in Fayette, Missouri, which is about a 30-minute drive from Columbia. We have extended studies locations, as many institutions do. Our extended studies sites are called the College of Graduate and Extended Studies, while our residential program we refer to as CLASS, the College of Liberal Arts and Sciences. Our residential campus hosts about 1,133 students, but combined, all of our programs with extended studies amount to 6,596 students. Also of note, in 2021, we accepted and approved a new mission statement. Central Methodist University fosters a diverse and caring community, empowering students to become lifelong learners, committed to academic excellence, prepared to engage in a complex world. So that is who we are.
Thanks, Sandra. So I think we'll start off here with just kind of the broad question. As you were in Weave Academy, we said, find a program that you want to work on. So what was the problem that you were trying to resolve when you tackled this project?
Sure. So we have assessment practices in place and have for some time with our main campus in Fayette, but our extended studies locations have some degrees that are unique to them that didn't really have assessment processes or even outcomes in place. So I was directed to one of those, our Applied Behavioral Analysis program, and was faced with figuring out, okay, how do I start this from ground zero? What's the best way to approach a conversation and have a connection with the faculty that's over this program? And how do I combat the disconnection that people sometimes feel if they're associated with extended studies versus our Fayette campus? So the disconnection problem and wanting to have a meaningful talk and how to address those assessment measures and get them in place. That was our starting point.
Yeah, and for me, I started with Central Methodist back in 2016. And so essentially I had inherited an entire program. All of the courses were already developed. We actually didn't know, but the outcomes were already developed. That is information that had not been passed along to me. And so, and we were just overall lacking a lot of data. Like everything was just very subjective in that when we would make changes to the program, really it was just based off of student feedback or what I felt like I was seeing. So super, super subjective. So it was really awesome. Sandra and I started meeting several times so that we could develop this process.
Great, Casey. And that's something that comes up often in conversations, is that those adjunct faculty or even full-time faculty who are just not plugged in at the main campus, and sometimes you get handed things and feel like you can't change them, or you don't even know what's been done in the past. So the second question here then is, so how did you approach this problem? So Sandra identified a program, but then it's not just a matter of you like tackling it and fixing it yourself.
Absolutely. And I think I had kind of maybe a naive view of what it would be like since I was new to assessment. I thought that maybe Casey and I would have one conversation and we'd figure it all out. And as she said, we had multiple conversations. One of the things I learned through the process is how important it is to just really get to know the faculty and really take time to understand their program, to understand the story that their program tells, and really to take that time. We work toward focusing on the full picture of what her graduates do, trying to reconnect some of the things that had been lost since she inherited a program, and the outcomes that we received she didn't know about. And then I think just coming to all of it with a willingness to change and a willingness to adapt.
Yeah, and for me, I just in general had to learn all of the things. Sandra and I met so many times, and each time I think I would say, I am an intelligent person. I have a PhD. Why don't I understand this? It was like such an abstract thought to me that I could not get the hang of it. And so she was super patient with me, and we really worked through everything. As a behavior analyst, I mean, I focus on assessment a lot, but I had never focused on assessment in this formal education way. And so it was a lot to learn, and Sandra was super helpful.
Thanks for saying that, because I think sometimes what we hear a lot of times is that assessment professionals, we know that we need to affect change on our campuses and we want it to happen overnight. And it's really a process. And I remember in talking to you all about this at the beginning, you were like, there was finally this aha moment one day where you were like, oh, I get it. And that's really what any teacher is hoping for. And as assessment professionals, oftentimes we wear the hat of teachers. So how about if you talk to us a little bit then about what you learned along the way through the process of working on this
Sure.
project?
So a lot. But one of the things that jumps out is just learning how to approach a different program and to think about what it does. With ABA, I think it's really similar to a lot of healthcare professions in that it has a lot of tasks and specific things that students are supposed to do in each course. And of course, there are so many tasks that was not feasible to consider all those tasks outcomes. So to take those and begin to brainstorm together and think, okay, what is the overarching idea here that these tasks are supporting, so that we had a manageable number of outcomes that made sense for Casey's students and what she wanted her graduates to be able to do. So that was a big learning curve for me. And once we started looking at it that way, we really began to make progress forward. Also, just review is important. I mean, I think we're both still shocked that there was this set of outcomes floating out on the website connected to a program that neither one of us had ever seen. And focusing on curriculum instead of courses, that's the driving factor behind the way we want to do assessment and the way we want to develop outcomes. And of course, just simply taking time to really understand what the faculty do, what their students do, so that we can really honor and highlight what's incredible about their program.
Absolutely. And as Sandra said, within the behavior analytic world, we already have a national organization that oversees us. And so they identify every task that we need to know coming out of that program. And the coursework has to be built very specifically to the way that they want it. And so the tasks are there, but as she said, there are hundreds of them. So trying to identify how they can be combined to get outcomes that are going to measure everything. The other thing that, Sandra, maybe you forgot this, but actually the outcomes that we had were specifically focused on practicum. They were even focused on like the courses. And so even like the define and discuss and analyze, that was not even a part of anything with our outcomes, which is so heavily ingrained in the task list. And so we did know what the outcomes needed to be, but there were so many tasks that we had to figure out how to kind of blend them together to have a manageable amount of outcomes.
So that you're talking a whole lot about some things that we cover in the Academy course about backward design and following that understanding by design model, which is understand what that end product is and then create the curriculum backward from there. And that sounds like that's exactly the approach you all used. So how about if you talk to us then a little bit about where you are now, because it would be disingenuous to have people think that you're finished.
Definitely.
Arrived,
yeah. I
right?
feel like we're just getting started. I think assessment is like cleaning your house. As soon as you start to do it, you notice all the other things that need to be done. Like, oh, I need to get to that. I need to tweak that. So right now we're in the thick of a lot of data and analysis. And we have a process in place for program review for ABA in the fall and for other extended studies programs. And I want to give Casey a chance to share about this because I know that she has data now that's going to be meaningful for her program that maybe she didn't have before.
Yeah, absolutely. So where I'm at right now is I'm actually Sherry talking about the backwards part of things. I'm starting where I am right now, the most recent courses that have been finished, and I'm working my way back because I revamped the program in 2017. I don't want to start from 2017 and try to make my way forward. That's a lot of data to come up with. And so I'm starting where I'm at, the courses that have just recently been finished, and I'm working my way back to hopefully, be able to see where we've come, what needs a change, what we need help with. And I believe, Sandra, this is what you were talking about when you said this, is that one of the really cool things about the behavior, the BCABA, BCBA certification is that the national organization, the BACB, actually publishes our pass rates every year for any organization that is offering behavior analytic certification. They publish pass rates. And so that is typically where you would kind of say, okay, so our students are struggling somewhere. The pass rates are 60% for first time test takers, or 80% for second time test takers. And it kind of gives you this feedback and this data that shows you what needs to be improved. However, they only publish that once you've reached a certain amount of students that have tested and passed or failed. And because Central Methodist University is a smaller university, we have not had enough students that have tested and passed or failed either way for us to know what our test outcomes have been. And so the thing that I really love about this assessment process is that this now is telling me those things. I can go back and look at the data after a course is finished and say over and over again, BH 321 students are consistently missing this outcome. I really need to figure out something so that everyone could be more successful in that. And that in return will help us with our pass rates once they are finally published, because then we can be confident that our program is doing what it should be doing.
That's great. And I love that you're seeing, excuse me, the value in this right at your program level. But then also I remember Sandra talking about how like this was one piece of the puzzle to kind of get her feet wet and get the process in place, that now this is going to be transferable to other programs on campus. So by building a culture and a process with one program, now you have something to work with going forward. So I like this image on this one. And the question is, how has this made a positive impact on assessment culture, either individually or for the institution?
Sure. So for me, it just reinforces the idea. We like to say everything is figure outable. So this is the perfect slide for that. But I think about the process with Casey and the the confusion, and then the dawning light as we began to understand each other. And I feel like I can apply that to working with other faculty and other programs as we move forward with assessment and get more processes in place.
And honestly, I think for me, because behavior analysis is so very important to me, it's what I've poured my whole entire life in my master's degree and my PhD. It's something that I'm very passionate about. And through this assessment process, I feel confident that we're going to be able to make really strong programs, whether at the undergraduate level or the graduate level, to ensure that our students can be successful in school as well as afterwards when they obtain their certification to become professionals.
That's great. It reminds me of a question from back when I think I was at the AAC&U conference, and they said, every time you undertake an assessment class, just ask yourself, how does this impact the students? How does this impact the students? So where do we go from here? What's next for CMU and the ABA program?
Well, going forward, I'd really like to get some tools in place for new faculty like Casey. So, which actually she's not new, but I would say newer to assessment. she's grinning like, yes, I know you're going to get it right eventually, Sandra. But so that they could just go to our website and have some tools that they could click on and say, oh, here's a video that begins with that backward design of what do I want my students to be able to do, or a short video on how does assessment improve student learning, just some things that will help them connect the dots and begin thinking and dreaming. Because to me, one of the fun things about assessment is, I know that sounds funny to people outside of our group, but being able to dream and really aspire and think, what do I want for my students? What do I want for this program?
Yeah, and I think that we're just going to keep moving on. We're going to keep doing what we're doing, and Sandra's going to keep being awesome and connecting with faculty that don't know what they're doing with assessment. And hopefully soon all of our programs will have this assessment in place so that we can continue to, once again, just improve and ensure that our students could be successful and that we're doing the best by them. And me personally, I am just going to continue to put my data in and adjust my program as necessary.
That is great. So thank you so much for sharing that. And you're right, Sandra, this is like the only conference in the world where we can say the fun thing about assessment is, and other people will get on board with us and also believe that that is true. So I really appreciate you guys telling your story about small seeds of change that are really taking root at Central Methodist, and the really huge possibilities that exist for the future of your institution and for your students who are going through not just this program, but all the future programs that are going to benefit from this. So thank you so much. We are going to turn our attention now to two other change makers in assessment culture, and these are from Truett-McConnell University. So I first heard about Dr. Tammy Mize when Weave Academy's former director, Dr. Ray Van Dyke, recommended her to me. I was looking for like, who's the right person that I should talk to, who's got great stuff going on. And so I asked her if she'd be interested in sharing with us. And the more I heard, the more convinced I was that we wanted to hear the story of what's going on at Truett-McConnell University. So we're going to hear from Dr. Tammy Mize, who is the director of assessment, and then Dr. Heather Ayers, who is the dean of the School of Nursing. So I'll hand it over to you ladies, and can't wait to hear your story too.
Thank you, Sherry. Good afternoon, everyone. It's going to be really hard to follow Sandra and Casey, but I hope that Heather and I will have something beneficial to add to what they have just shared with all of us, which was very inspiring. I am the assessment coordinator here at Truett-McConnell University. We are a private Baptist university located in the beautiful mountains of North Georgia. We're located about 80 miles from the Atlanta International Airport. TMU's mission is to equip students to fulfill the Great Commission by fostering a Christian worldview through a biblically centered education in a family-friendly environment. and we are very proud of our identity in that. Our enrollment is just under 3,000 students. We offer 15 undergraduate degrees and 7 graduate degrees.
All right, thank you. So we're going to lead this off in a very similar fashion of, so what was the problem that you all had to tackle when you approached this assessment project?
Well, we in the Office of Institutional Effectiveness here at TMU, there are 3 of us. We felt like we needed to do a better job of articulating the many benefits of our assessment efforts. That assessment can be not only good for satisfying our accreditors, but it can go well beyond that. And we wanted to sort of turn the attention more toward the impact that our assessment efforts can have towards student achievement. And if not for the students, we wouldn't even be needed. So let's emphasize what's most important, and that is student learning.
We also wanted to combat complacency. In the School of Nursing, we were dealing with some complacent mentalities in the faculty. We had had some previous low board scores looking at the national licensure exam for RNs. And so we took an approach looking at our external accreditors, looking at CCNE, our Board of Nursing. So we began to recognize what do we want to implement and how do we want to live out our mission for the School of Nursing, and recognition with student achievement, what is most important for us. So we began by restructuring and resequencing our curriculum. We revised our program outcomes. We mapped everything across our curriculum, and we also revised our assessment.
I'll just say one more thing about complacency, and that is if we could get across to people not to be afraid to give up the good, to go for the great, as Rockefeller once said.
That's great. So, and so Heather, I was like, man, you tackled a lot of stuff. So that's fabulous. And Tammy, if I can just say the sound, it's just cutting out just a little bit. So maybe if you just turn up your volume just a smidge. So we'll look at this question then. How did you approach the problem then, Tammy, when you set out to work on this particular assessment riddle to solve?
Well, we did several things, one of which was to take advantage of what Weave and Weave Academy have to offer regarding webinars, workshops, and courses. This provided us with an opportunity to stay current with the best practices in the field of assessment. And then once we were equipped with this cutting edge knowledge that we gained, we needed to figure out how to share these best practices with our faculty and staff. So we decided to just take a whatever it takes attitude when it comes to communicating with our various audiences across campus. Because individuals have different backgrounds and they have different levels of understanding when it comes to assessment, we knew that it was going to be really important to be sensitive to each person that we communicate with. We knew that we needed to have an open mind going into these conversations, and to show that we in IE truly have a passion for teaching and learning. And our hope was that this passion would simply become contagious, one person at a time.
So in the School of Nursing, we particularly looked at training and feedback. Again, I mentioned earlier that we began to tackle the entire issue of our curriculum, looking at the mission statement of our school, what our program outcomes were and what they should be. So we used that. We spent several days a couple of years ago trying to rework the entire program. So again, we use curricular maps. We spent countless hours mapping our course objectives and our course content based on the NCLEX test plan by the National Council State Boards of Nursing, the CCNE BSN Essentials, and CUSN looking at quality, safety, and education for nurses. And then we recognized because there was this mentality that accreditors were out to get us, and we knew that wasn't true from a standpoint, because we recognize that CCNE, like the Board of Nursing and like Tammy can mention, according to Sachs, is that their desire is for student achievement and success. And so if our desire aligns with them, then we can utilize their feedback to enhance our students' success and improve our programs.
As in an institutional and SACS accreditation goes, you know, it's really hard to settle everyone's nerves before as well as during a site visit from our accrediting agency. But we try to get across to everyone that these accrediting agencies are not the I gotcha police that we have been led to believe. They're actually our peers that are simply charged with reviewing our assessment practices and giving us constructive feedback. And once we realize that they're not a threat, but simply our peers, then that helps us to look at it in a whole different light.
I love that. I'm going to point out one thing I really loved in what you said there is that idea of whatever it takes. So there's a lot of people on this call who are assessment directors that are like, well, how do I do this on my campus? How do I do this on my campus? And your approach is, I'm going to do whatever it takes. If it's one-on-one, I know you've talked about that before. If it's a one-on-one phone calls, if it's stopping to listen, and Sandra said the same thing, like it was a lot of effort to make time for those conversations that pay off in dividends. So talk to us a little bit about what you both learned along the way.
Well, first and foremost, what I learned is that you better figure out how to keep it simple because it can be overwhelming if you, like, what is assessment? Well, really, it's just in a nutshell, 3 things. Number one, what is it you want your students to be able to know and do as a result of your course or your degree program? Number 2, how will you know if they've learned those things? And then number 3, once you know that, what are you going to do about it to improve student achievement? So we take those 3 things as our foundational building blocks to then continue to work toward a robust assessment system. So starting simple has proven to be very advantageous for us here.
And I think that Tammy certainly taught me those simple steps, and that's how I actually began to understand what our assessment needed to look like. But we also recognized we had to have this willingness to compromise. So from a standpoint from either institutional or within each school, we needed to be able to hear faculty out what really about these certain content areas or courses or student assignments really drove passion for them. We had to have multiple conversations, which we recognize is a very slow and arduous process, but it gains faculty buy-in when they are heard and when they get to voice their opinions. And they also, just to recognize that we need to continually support faculty in the assessment piece and with the feedback constantly.
As Heather said, while we have a willingness to compromise, we, on the other hand, also tend to agree that sometimes there are non-negotiables. Because our commitment to institutional effectiveness is a serious one here at TMU, there are some absolute non-negotiables. One of those is that you can't choose to not do assessment. That will not work. Number 2, you also must adhere to best practices. And I have a fairly current example that I can share with you in that. Not long ago, I had a conversation with someone who was wanting to write a student learning outcome by stating that the students would be able to grasp certain concepts within a particular course. And I'm saying, no, you cannot use the word grasp because you cannot objectively measure that. And so we have this back and forth concept or a conversation about this, wherein I had my way in the end because we were able to agree that that student learning outcome would sound much better and work much better if we said something more like, instead of grasping content, that we would have the students to apply certain concepts or principles toward a real world situation or problem. And then you see how you can objectively measure that. And so happy ending to that story.
And I would not want to be the faculty member on the other side opposing Tammy, right? I love that. But this slide, I just really like those two principles of a willingness to compromise, but an agreement on non-negotiables. So I think if there's some like really practical piece of information for other assessment directors to take away, that's just a huge one. So all right, so we will, would like to hear now about like where you are now in this journey.
Well, I hate to start out by using a cliche of good to great, but honestly, that's where we are here. It's probably more accurate to say we're moving along the continuum of good to better rather than great. Maybe one day we'll get there, but this movement that we've had along this continuum has really been a decade or more in the work. It has not been always smooth. It hasn't always been easy. In fact, it's been a lot of hard work. But nonetheless, where we are feels good. This whole push towards excellence reminds me of a poem that was written by Charles Osgood back in the mid-'80s called Pretty Good, wherein he speaks about the dangers of accepting mediocrity instead of striving for excellence. So on our campus, we try to convey that, guess what? Pretty good is in fact not good enough. We can't become complacent. We must continue our move along that continuum of good to great.
And as far as in the School of Nursing, we create this culture of reflective practice of faculty to recognize what content that we're teaching, what assignments are we requiring of our students, how do we assess and measure our students' ability. So now we have this stronger assessment of our program, because historically our assessment, and Tammy can attest to this, was an assessment that only measured really one component of our students, and it looked at their clinical evaluation performance based on their clinical tool. So now our assessment measures some of our program outcomes that include autonomy, professional practice, leadership ability. They have assignments that they have to do. They also have to choose a role where they actually will be placed in a position of leadership. We also look at critical thinking and much more data, including NCLEX scores and such. So by utilizing this data, we've been able to provide a better assessment of our program and even improve for our students' success.
It's great. One of the things that we often talk about in best practice is multiple measures for assessment, so that we're not getting that one note picture of our students. So how has this made a positive impact on Truett McConnell or on you individually as far as assessment practice?
Well, I'm happy to say the paradigm has shifted on our campus here at TMU. There are multiple forces behind this gradual shift, but I can tell you that there's no magic formula for creating a healthy culture of assessment. It takes time. It takes hard work. What works for TMU may not work for your institution. You just have to assess where your institution has been, where it is currently, and where do you want to take it. And then prioritize and tackle what you can based on the resources that you have available. You cannot eat this whole elephant at one time. I would be willing to say if you try to do that, that elephant will eat you. So you really need to take it one simple step at a time, one bite at a time, and over time, you will see benefits happen.
So a couple of things just to address: respecting the process, certainly focusing on faculty engagement so that they do have buy-in and ownership into the assessment piece. And reminding everyone that the focus truly is student achievement. As far as faculty development, we just for the first time had an off-campus retreat a couple of weeks ago. So we focused on faculty development, improving teaching learning practices, ongoing dialogue about our assessment. What do we realize worked? What do we think we need to change to improve our program and our student success? So not only do we find an annual assessment time, we look at a continual move toward improving assessment literacy for our faculty. They have a better understanding of what assessment and what weave looks like to them. And then we created a culture in the School of Nursing where we're not only just doing the assessment, but we're using the assessment data. So we've created the culture of using that data that we've collected to reassess our students, to transform and improve our program outcomes, and to improve student achievement.
I'll just speak briefly for the sake of time on speaking the same language. Basically, if you have a concerted effort to engage in ongoing dialogue about assessment, it's going to bring about a higher level of assessment literacy on your campus so that you can all begin to speak the same language. And as far as balancing mandates with opportunities, I believe assessment can go all wrong if all you focus on is the compliance. So you want to use the mandate to open up other opportunities to improve not only student achievement, but to improve the value of your degree, to improve the value of the degree that students receive from the university. And then as far as changes and actions, just make sure any change action that you make is for the sake of student learning. If you're not looking at student learning as a result, then you're going in the wrong direction.
We often hear from folks in Weave Academy about that piece about speaking the same language, and folks say, okay, the first thing that I need to do on my campus is we need an assessment glossary so that we're all using the same words the same way. And that's really huge. So if you'll talk to us for a minute about what's next for TMU, and before you jump in on that, I'll just mention to all of our attendees, we're going to have some time for some Q&A in just a minute. You can put questions in the Q&A or the chat, and I see a few have come in, and I'll start fielding those right after Tammy and Heather address this next piece.
So where do we go from here? Well, of course, we keep moving up. Some areas, as you see from the diagram, have more room for growth than others, but our goal is to continue to push forward. In order to reach an exemplar status, you must keep doing certain things over and over and over. For example, constant conversation, and Heather's going to speak to that.
So an example I'd spoken with Tammy about, when we began to revise our curriculum and restructure our courses, we had a summer mental health course, which was between the junior and senior year. And we had a little difficulty with that because obviously the students did not have a break between those 2 years. We recognized they had some disadvantages for finding externships, but we also recognized as a faculty, we didn't have the opportunity to reflect on what had happened the academic year previously and to plan and improve for the next year. So we proposed that we put mental health in the first semester for junior students, which some apprehension about that because of just the nature of what mental health means, and recognizing that the first semester is very challenging. And so while we had some substantial reasons for changing that, we still had some skepticism from faculty. So we recognized that in order to change and improve, we had to kind of jump or forward and kind of try something out. And so as our faculty retreat a couple of weeks ago, one of the skeptical individuals stated, I remember when I thought mental health wasn't going to work in the first semester. And so we reflected on why it did work, and we've recognized the tremendous benefit that our students gain from having it there. Obviously, we're all teaching a generation of students that are at times communication illiterate, not to be negative, obviously, but they just have difficulty with face-to-face conversations, recognizing therapeutic and non-therapeutic communication. And so we've really pushed our students in the direction so that they actually exhibit professional communication right off the bat, right out of the first semester. And that's been manifested in even our clinical counterparts have seen that and reported that in a positive direction for us.
And just real quick, like, don't forget to continue to sharpen your saw. Whatever that may be, whether it's utilizing what Weave Academy has to offer, joining professional organizations, conferences, reading books, articles, networking with colleagues in or out of your area, and feedback. We've mentioned that multiple times in this session. It's a give and take. You want to create a culture on your campus where collegial feedback is the norm and not the exception. And that concludes our presentation.
Thank you so much. There's so much wisdom in there. I loved, I'm kind of selfishly loved the preparation for all of this because I learned so much just talking to you all. We do have a couple of questions and we've got a few minutes for Q&A. So it looks like maybe Sandra and Casey answered some in the Q&A in text, but here's one for Heather and Tammy. How did you use the Weave platform to support the redevelopment of your assessment process?
Well, I would say that for us as an institution, Weave was the platform that we had selected and agreed would house our information. And it seemed to work with the story that we wanted our assessment to tell. And that's another thing that I try to get across to our stakeholders is that your assessment should tell a story. And the way Weave has everything set up inside their platform, it truly can tell the story. It goes from one thought and idea to the next. And so for us, Weave worked beautifully with how we wanted to tell the story. Now, Heather, on the other hand, she at first had a little difficulty understanding, but I had been in Weave more than she had. But I do remember working with her, and she was frustrated. And then after a really long time, and she can speak to this, but one evening late in the day, she basically communicated with me. The light bulb came on. I got it. Heather, do you want to talk to that?
Sure. Well, I think the problem that I had, because I kept looking at this assessment, and I remember telling Tammy, I've been doing assessment for about 2 years, really. Telling her, we are only evaluating or assessing one component. She's like, I'm like, that's not enough. I mean, it doesn't give us a bigger picture of our program. It only really looks at our students' clinical performance. And the way our tool was designed, if our students weren't successful, then we had nothing to assess them with. So I really just kind of jumped off the cliff and wiped the slate clean and began a whole new assessment, which was very daunting at the time. But in order to get the bigger picture, I had to wipe the slate clean and start over. And then it really started to click. But then I've also since then been able to pull in in Weave. I've tied our BSN essentials to our program outcomes. I've pulled in the NCLEX test plan to our program outcomes. There's a lot more to still do because we can evaluate faculty through Weave. We can evaluate our NCLEX test scores through Weave, all of that. So there's a lot more that you can do that we have just kind of got a part of that started.
Thanks for answering that for him. That was, so I'm getting some questions from folks about the Weave software, and for certain, we're happy to answer those questions. So I won't try and answer them here in this setting, but you can visit weaveeducation.com, request a demo there. You can also find us if you're part of the AALEG conference. You can find us in the conference app, and we have a vendor booth there that you can connect with Kathy Farrelly on that. I did want to share, as was mentioned a couple of places in the presentation about Weave Academy, we do have interactive professional development available, and we've got some things upcoming. Our class that's starting next week is already full, but we will have another section of Introduction to Effective Assessment in the fall. If you'd like to be on the wait list for that, you can go to weaveeducation.com, go to the Weave Academy and enter your information, and then that way you'll be notified quickly when new courses come up. We have a class starting in July. This is a new class about assessment-informed teaching and learning improvement. And we had a webinar about this just last week, and we're really excited about this new course that we're launching, along with some other things that you see on the screen here. So ladies, I just wanted to express our thanks on behalf of Weave once again for a fabulous session. Again, just so much good information. And I'm really pleased that we were able to address some questions for folks in some different discipline specific programs, which is one of the requests for this AALHE conference. So hopefully folks out there found that useful. And we thank all of you for joining our session and hope you took away some valuable information. So we will see you all in the AALHE conference app and hopefully in other places in real life sometime in 2021 and 2022. Thank you. Have a good afternoon, everyone.
Thank you.
Thank you.